Okay, so let's quickly compare a regular pillow versus the elevated pillow and the differences, the reason why I designed this pillow, and the benefits of having a contoured pillow or a cervical orthopedic pillow versus a regular pillow. I want you all to first look at the anatomy of the spine. You can see from looking at it from the side that we have these curves, and this is naturally how a spine is designed to be. Now, this is considered a neutral position, so the muscles surrounding the spine are going to be more rested and relaxed when your spine returns to this overall shape. So if we keep that in mind, the curves of the spine, and then we take a look at this pillow here, we can kind of see that this isn't going to support and fit any of the natural curves, especially around the neck, since this is a sleeping pillow for the head and neck. All right, so when we have that curve in our neck, again, keep in mind that's the neutral position, everything is resting, and that's going to honestly de-stress our joints the most. How can this pillow support that, right? So when this is flat, we have a tendency to sleep in all kinds of unnatural positions. That's going to create and develop imbalances. That's going to create and develop issues in our neck. And then we kind of wake up with our neck stiff, painful, inflamed as a result of the sleeping positions. And as they're straining for 4, 5, 6, 7, 8 hours, however long you sleep, they're going to start to tighten up on you. And so generally you wake up in the morning, you're going to feel like you didn't get a rest. You're going to feel like, what happened to my neck? You're going to be grabbing and massaging it. And again, that's the result of this pillow being too flat, right? There's no support for the actual curve in your neck. So let's change this pillow out and let's put this pillow down, right? So now we have more of support for the actual neck as opposed to that pillow there. With this part right here, all right, so this is a natural little curved tube, and basically that's going to support your neck. It has a little ramp here for your shoulders, so it has some give there. And then we're going to allow your head to kind of fall into the middle. It's going to sink down into the middle. And so naturally, as your head falls back into the middle there, that's going to also open up your airway. But it's going to more so support your neck as opposed to your head. And again, we're going to avoid pushing your head forward when you're trying to sleep on your back. The difference between sleeping on your side versus a regular pillow and our pillow. So let's switch this out. Again, an elevated pillow, we're going to put that over here. Regular pillow. This is what we commonly see when we begin to lay on our sides. All right, so on this pillow, when we have it super flat, regular pillow, no support for the curves, we have a tendency to kind of sleep with our heads here, and we can kind of see our head is going to fall down in towards the bed itself, right? So naturally, ideally what we want when we're sleeping is the head to be level. Okay, so even though we're on our side, we still want our spine to be straight in this position. So we have to have some kind of give and support for the shoulder and account for that curve in the shoulder. And so this pillow, we don't have that spacing being accounted for. We don't have anything to kind of support and kind of remind us to prevent us from drawing our arm up too far, because we have a tendency to kind of sleep like this, our hand underneath the pillow, and then it's going to have us sleeping in this position. All right, and so this is kind of important as a chiropractor, and this is what we are kind of preaching about, is keeping this space open right here. So this is called the brachial plexus. We have a network of nerves and blood vessels that sit here that run from the neck down into the hand. And so we have a tendency to sleep with our arm above our shoulder here. Then we have a tendency to wake up and that hand is numb, right? We don't have a feeling in here. So we have to wake up, we have to shake it, generally kind of move it, that blood is going to circulate. But that's not a good feeling, right? And that can honestly lead to more stress and wear and tear of the blood vessels and the nerves here in the brachial plexus. And that can lead into more neck problems in the future the more that you sleep in that position. So then we switch out this regular pillow with our elevated pillow. To kind of resolve that issue of the arm going numb, let's place this down. Automatically we see this is already lifted up a little bit higher, okay? And then we have a contoured curve that's perfectly designed for our shoulder to already land. All right, so now with the elevated pillow and a curve here and a place for our hand to land, now we can land our head here, which is going to balance out in the position of our head, going to raise it up from that drop down position, and it's going to place our spine in more of a neutral position, okay? When our spine is in a more of a neutral position, that's finally when our muscles get a chance to recover and relax, and that's when it's going to lead into well-rested sleep and a better sleep position. And then you're going to generally prevent your arms from drawing up too far, and so that's also going to protect that very important space there, that brachial plexus, and that's going to keep the blood flowing into your hand. A lot of times when I get a lot of patients that come in that first visit, I always get that common question. I don't know what I'm supposed to be sleeping on. I don't know how I'm supposed to be sleeping. And then when I tell people, you want to try to avoid sleeping on their stomachs, I've been sleeping like that all my life. How am I supposed to do that? But then what they're coming in for, neck and lower back pain, and they don't know why or where that came from. When we're sleeping, we generally sleep with our hands above our shoulders, again, affecting the brachial plexus. And generally we have to turn our head either to the left or to the right in order to breathe, right? And so imagine sleeping in this position every day, every night, for months to years, right? So eventually that rotation is going to start to get held in the neck, and that's going to start to, again, change the overall shape of the spine, lead to imbalances, lead to neck issues. And that's one reason why we don't want you to sleep on your stomach. Also, added benefits of this pillow, the overall pillowcase itself. The pillowcase, we can unzip it and easily take it off and wash it. Even though it's white, we can throw it in the washing machine. So the inside you can kind of see is memory foam. Again, so that makes it more comfortable. And again, we're able to design the curve and contour the curve specifically for your body there. And again, it stays breathable, so that also leads to the pillow being more cool throughout the night as well, okay? But generally when I sleep on this, I put a pillowcase on top, all right, just to kind of protect it. I wash the pillowcase, and I also wash the case of the pillow itself. Now, it has two different features. The very base of this is the largest part or the largest curve. But sometimes when we're going from a regular pillow, a flat pillow, to a contoured or curved pillow, that may be too much on our necks, right? It may be getting irritated because of the stretch. Generally, what you can do is reverse this, flip it over to the smaller end. It does still have that feature, that tube there to support the neck. It still has that on-ramp there, but you're gonna let your head fall back into the middle, and that may be a little easier to start on this pillow, especially if you've been sleeping years on something that flat and your body, it takes a little bit of time to get used to. So that's also the last feature of the pillow, is it's two different sizes, so we can try to find the correct fit for the specific neck we're trying to support.